Professor John Packham. John, just tell us your first thoughts upon seeing the film.
I think it's a really eye-opening film, actually. EDS is one of those Cinderella diseases where it affects so many different things, but actually people go, oh, it's just EDS. And actually to see the impact of EDS on people's lives and the level of severity that you can have with EDS and the impact is actually very eye-opening and very useful in an educational thing for doctors, general population, health professionals everywhere. I think it's a really useful way of impacting people and making them think about it as a disease entity.
Maggie in the film actually talks about the importance of searching for somebody who will advocate for you, search for the right person who can help you. In every single message I've received, you are one of those people, you are one of those kind of advocates, but you have been a massive support mechanism for certain individuals. Why is that for you? Why is it of such importance?
I mean, I look after an awful lot of diseases. And I think I hope that I treat people with EDS no differently than I would do any other disease. It's not in the head. I know I've heard that said by a lot of people with EDS. It's a real disease and it has real impacts, and you try and give an overview and direct people to the right people for the right things which are going wrong with that person. It's a very, for those people that have EDS where it's more than just joints and it's affecting their heart or their lungs or their kidneys or their bladder or their bowel, I don't have the skills to do all that. I need to involve other people from the medical profession because they're the people that can help with those bits. So as a rheumatologist, I'm great at joints, I can do that, although actually it's the physios that make the difference for people with EDS, not me. But I do need help with the other stuff.
And Mark, for you, I guess, is it as deputy medical officers, is it simply about trying to connect those dots to provide better pathways?
I think firstly I'd like to say I thought the film was really powerful. I was very grateful for people prepared to come forward and share their stories, so it was a real learning experience for me. I think there is something about complex diseases that need coordination, and it's not just EDS. There's a whole range of patients that have multiple system diseases or have a number of complex diseases that need coordination, and it is something that we're not great at. I think we recognise that. We also have departments that are massively overwhelmed with the workload they're trying to do. And I think there is a need to think about how we coordinate. And it's definitely something that we need to look at, not just for EDS, but I think it's a good starting point.
And Vikki, for you, just tell us a little bit about your personal journey.
Yeah, so unfortunately I came a little bit late to the project, so I wasn't able to share my story, but I've suffered ever since I was a child. I always thought the pain that I had and the medical problems that I had were just one-offs. Nothing was related. I was told it was growing pains, which I don't even think is a real thing. And I was diagnosed when I was 27. So in school, all I ever wanted to be was, I wanted to be a fitness professional. I wanted to be an exercise to music instructor and teach dance, and I did that. But then it started becoming too much. I was having too many episodes with my joints. I was taking painkillers in excess before and after, and I just couldn't maintain. And with EDS, I think a lot of it is about being able to grieve, because you see your life so differently.
It's okay, take your time.
And when you get a doctor believe you, because for years I just thought I must be crazy. Why would I want to feel sick? Why would I want to be unwell? And to find that person that believes you, it just means the world. And then moving forward, I was diagnosed by a rheumatologist, a really fantastic one in Shropshire. Unfortunately, he moved on, and I've never found anyone since that's been able to help me. I get more symptoms, and I don't have any support at all. I go to the GP, they told me to go to rheumatology. I can't get appointments, and it just kind of goes round in circles and you give up. So for those that have been lucky enough to find it, I'm so glad they have. But for the rest of us, we spend a lot of time looking for that. It's not a validation necessarily, but it's just someone that believes that what you're feeling isn't in your head, because that is the biggest thing that has such a negative impact on your mental health. And I think all of us have struggled with mental health problems. And it is, I think, a normal thing for us to just kind of put things aside and say, it's only EDS, you know, you've got to live with it, and you smile through it and you laugh through it. And like Bjorn said, you have your silly stories and that. And then one day it's just too much. And you are allowed to have those days to grieve what you thought your life was going to be like. But having people that want to support these kind of unseen illnesses is so important, not just for EDS, but for so many conditions. And to me, I always feel a multidisciplinary team approach is the best way to get the right support for these patients, because it affects so many different systems, and they're all treated separately by separate people. So being able to come together and discuss these patients, I think, is a super important step forward, hopefully, that we'll see in the future, because we do MDT approaches for many different conditions nowadays. So hopefully these sorts of conditions will get the same sort of spotlight, and hopefully films like this will really help. I know I'm going to be forcing all of my colleagues to watch it. I've had a few approach me already, and I've said, I will make sure you've watched it. I want to see it physically on your devices so that I know that they're going to be aware of it. And us coming forward and being honest and telling people about our journeys. Like, people are dead polite and they'll say to you, if you don't mind me asking, why do you wear braces? Why do you have a stick? Why do you have this, that, or the other? And I always say, no, it's not a problem. Let me tell you about it. And you know, they have to eventually just walk off, because I'll just keep talking about it all day, trying to get the point across. But yeah, being able to have people that really want to listen and really want to just be aware. It's not about knowing the answers. It's about being aware of the condition and just listening to people and supporting people forward.
First and foremost, can I say thank you? And a round of applause. Thank you so much. It takes, as we've discussed with those involved in the film, and I know you came late to the project, it takes a very special person and brave person to come up and talk so freely, so thank you.
Thank you.
I'll try not to ask you so many questions. We don't want lots and lots of tears, but thank you so much.
I'll probably cry anytime
you
ask anything, because it's just having people that will listen, and there's a whole room full of people here that want to listen, and I appreciate every single one of you for making the time out of your probably exceptionally busy days to come and watch this, because I think just being aware is so important, so thank you all.
No, thank you for sharing your story. Mark, when you hear stories like that, do you hear from the individuals, does it emphasise that kind of importance to share staff awareness and to start to connect those dots?
So I think it is really important to raise awareness. I'm still not. We have a room with people who are diagnosed, and you know, you can then look back and say it was obvious here. What I worry about is how we start from a non-specific population and we then move forward, because foresight and hindsight are different things, and that is where I think some of the complexity comes in. I'm really sad to hear colleagues dismissing people. Often because they don't know. And it's easier to dismiss somebody as making it up rather than admit you don't know the answer. I'm an emergency physician, so I'm quite used to telling people I don't know what's going on. But I think a lot of my colleagues struggle with that as a concept. So I think MDTs, groups of people that work together, that have a low threshold to suspect these illnesses, is a really important step forward. I think it's complex, obviously. How we do it as an organisation is complex. How we work with our specialist centres nationally, Sheffield, London, I think is important. But we also need to work out how we do this locally, because we can't necessarily send everybody to Sheffield, because it's a long way. It's probably easier to get to London, to be honest. But I do think as an organisation, it's something that we need to think about, how we manage complex illnesses, complex pathology, how we use the MDT approach, how we use patient stories, You know, the patient knows what's wrong with them. You just have to listen to what they're telling you. If you can't piece it together, you know, your point about having a whole series of things happening through your life and thinking that there are 70 different events, at some point somebody has to stop and say, is there one thing that links these 70 different things? And I think that's where an MDT and people interested makes a difference.
Jared, if you don't mind me coming to you, Annabelle's challenge, you give us a brief kind of synopsis as to what you guys do and how it came about, but just take us back, because it was your daughter, Annabelle, when she was 3 years old.
Yeah, so since she was a baby, bruised quite easily, a lot of it was spontaneous. We've got 2 older boys, we could compare, and we didn't have those issues, so we knew something was different with Annabelle. And eventually we did get in front of genetics, but they dismissed it, said no, she's not got it. But we were adamant that we wanted a test doing, we'd pay for it if we had to. We then reluctantly, from their point of view, referred us to Sheffield. Sheffield even said, don't think she's got it, and then a week before Christmas we got the diagnosis. And because she was 3 years old, she was the youngest in the UK. So that was our first encounter of EDS.
How much of a weight off your shoulders almost is it when, again, speaking to those who get that diagnosis, and even if it's taken 10, 15, 20 or more years, just when you know, that in itself is quite something.
It's not nice news to have delivered to you with this condition, but once you've got that, you can start planning. So you look at the management side of it, maximising life as much as possible and looking forward, putting your care team together, which is always difficult, because even when we created the team that we knew should be looking after Annabelle, people do move on, they retire, they emigrate, so you're constantly having to keep your team up to date and looking ahead.
So what are the challenges that you face within Annabelle's challenge? Because like you say, you're primarily a vascular EDS charity, but you are NHS listed, therefore people just come to you with every single type of EDS, and I guess it's difficult for you to manage.
It's putting pressure on resources, but we don't dismiss them, we don't just fire them off. You know, we'll listen. If they ring the helpline, those calls can be quite a lengthy call and can be quite upsetting when you're listening to their stories and they're not quite getting where they need to. They're getting dismissed. They're getting GP doesn't understand, refer to a consultant doesn't get it, back to GP, and they're just trapped in this circle. And I really feel for a lot of people, it's getting better, but we're nowhere near where we need to be.
And Professor Packham, how does that for you need to look, those patient pathways?
It's such a spectrum of disease, and I think one of the important things to say is that hypermobility syndrome is not a non-diagnosis. And there are loads and loads of people out there that are just stretchy, and they don't have EDS, and trying to differentiate between that group and the group that are at risk of getting those other stuff that are at the far end of the spectrum. About 10% of teenagers have hypermobility. It's really, really common. I'm very glad that 10% don't have EDS, thank goodness. And it is trying to identify those patients that are going to be higher risk, that do need that multidisciplinary care, and trying to tease it out. I think there is a real problem in perception, particularly actually in the south of England, that hypermobility, well, that's not a real disease. You know, you've got to have EDS to have a real disease. It's just not true. And hypermobility is just as important, and to be honest, for the musculoskeletal stuff, the treatments are identical pretty much. You know, you still need to strengthen the muscles and keep mobility going and manage the pain. It's the same for EDS and for hypermobility. But in terms of a specialist pathway, it's trying to tease those out. And I don't want to say get the wheat from the chaff, because the hypermobility group aren't chaff at all. But it's kind of that message.
How important? I mean, throughout this journey, I've heard a lot about genetic testing. At the back end of the film, we've heard Jane discuss the maternal grant that they've applied for to try and test more genetics, if you will. How important is that? And is that a good step forward?
It's a difficult step forward. There are some very specific bits of EDS where the genetics is well understood and is clear. For hypermobility EDS and hypermobility, actually the genetics is very, very fuzzy and usually not helpful at all. And it's, and you know, you can't genetic test 10% of the population. It's not possible. You know, we'd stop doing hip replacements. So it's very difficult to tease out. I think there is an over-reliance on the genetics, and because it's a test where you can say, yes, you've got it, people see it as really important. Actually, for me, it's the clinical mix, it's what's going on with the patient that's much more important. And so it has uses, but don't get over-reliant on it.
And Vikki, for you, how do you manage your condition now currently? How are you in yourself, and how do you find yourself moving forward?
Well, I self-manage, so I don't seek out any medical care anymore unless I'm asked to go or I can't manage something by myself. I'm good in myself. I always think to myself, it's a good day when, you know, you wake up and you're no worse than yesterday. Like I said, it builds and builds and builds, the way you have days where you're like, yeah, I'm so good, I'm great. And I am one of those people that will put a face on it. I mean, I work full time. I have a 4-year-old son. Like, I'm quite a busy person. I won't let this keep me down. So every day that I am no worse, I always think it's a good day. So I'm much better now than I was kind of 10 years ago, before I had diagnosis and before I had any answers. But all the research that I've done has been my own, and I self-manage. So I will continue doing that, and always happy to help people if they need hints and tips on self-management. But yeah, in myself, I always think I'm great. I'm in a great point in my life. So my condition is just something I live with.
Amazing. Ladies and gents, we have around 5 or 6 minutes or so. This is your opportunity. If anybody does have any questions for our panel before we wrap things up, yes, we'll go over there.
Just with looking at an MDT approach, is there any merit in speaking with the guys over at Stanmore and bringing that more local? Because I got a diagnosis, I burst into tears when you started talking. My diagnosis was exactly the same as you, 27 years old. We could have been talking about me. And they tried to get me into Stanmore for inpatient treatment to be able to get a management plan going forward, and that is very much an MDT approach. But it's so hard to get in. I've been private to London, to Dr. Alan Hakeem, I've been through NHS, been through every avenue, and I still couldn't get there because of all of the red tape. And that's something that I think a lot of people experience. I've had some wonderful experiences. I've been very lucky in some of my consultants, but I've equally experienced really horrific people. And I mean, hands up if you've ever been there and they said, "Are you sure you're not just anxious?" And that's like a red flag to a ball. I've had it so many times, but I could tell you, like a cardiologist that's amazing for EDS. I could tell you a gastro that sadly is now in America, that was amazing for EDS locally. I could tell you, like, all of these people, but maybe the Stanmore approach is what we need to look at locally. Because I know people say it's rare, it's not rare, it's just rarely diagnosed because enough people don't know about it to give the diagnosis.
Mark, I guess that's for you. Is that something that you can look at, Stanmore?
I think the simple answer is yes. I think, you know, looking at where the model works elsewhere is always a good first step. You know, why reinvent a wheel if the wheel's working somewhere else? I very much know the gastroenterologist you're talking about, and I think, and I think at UHNM, I think we have a number of consultants who have an interest, but what we don't have is necessarily an MDT approach.
I could tell you a vascular team as well, that like all of those, because they all are very aware of it.
Well, as you've said, it's important to take what works and see what we can implement. Anybody else? Tanya?
What can we do more as a trust around the isolation piece? That came along out. Oh, thank you so much. Do I have to repeat all that? No. Okay. Yeah, great. As a trust, what can we do more around the isolation piece? Because that came across loud and clear. There's the physical aspect clinically, there's the mental health aspect and the isolation that comes around along with that. What can we do as a trust more to help our patients in that area?
I suppose I have to be very careful what I say with the non-exec director asking the question. I think the reality is it is an MDT approach, and you work out what are the key components, and then we look at how we facilitate that. I think there obviously is a very strong psychological component when you've had a nasty, debilitating illness for 20 years, when no one's diagnosed you and everyone's telling you that it's in your head or you're anxious. So there is a degree of that, I would imagine. So I think it's about working out what's needed, looking at the resources we have, and working out how we do it and how we work with the national centres. And it may be that if there isn't the service that's needed at the national centres, then it's the conversation with NHS England about what they're commissioning. I think there's a day-to-day thing which is about clinicians listening and knowing just because they can't make a diagnosis doesn't mean there isn't one. It just means they don't know what the diagnosis is. And then there's the bigger piece about what's the systematic changes we need to do that won't happen quickly and will either take disinvestment somewhere else or finding money from somewhere, particularly in the current financial climate in the NHS where we're trying to save millions and millions of pounds and you're trying to work out what other services might need to be downgraded. So I think it's the two-step, which is the knowledge bit, which I think this will be a massive support for, and I would be expecting this to be on our intranet fairly soon, and then it's the bigger, more systematic piece.
Okay. Any more questions for the panel? Yeah, over there.
Sorry, just to clarify, I was one of the people that worked on the project, and we hope to apply for a grant. We haven't received it. We hope to apply for a grant, and it's looking at maternity care, not genetics. So it's just to clarify the video and some of the comments you were making. It's a hope. If anyone else wants to give us funding, though, I'll greatly receive it.
Fingers crossed we have a few hands up in the air for that. Any more questions to the panel? Bjorn? Maggie?
More of a comment, really. Mark touched on the inevitable mental health challenge, as did all of the people in the film. And I think there's a catch-22 there because they will have anxiety and mental health issues as a consequence of their physical problem, but then it very rapidly can translate into somebody assigning their physical symptoms into an anxiety problem, and then they don't want to acknowledge the anxiety problem because they think they'll be dismissed because they have been so many times before. I'm sure that's obvious to most of the people in the room, but it is a major distinction that needs to be drawn, that it's a secondary anxiety problem, and that's something that clinicians just need to get. It's not that complicated, but they seem to struggle with it.
Okay, thank you, Maggie. And just finally, Bjorn?
Yeah, it was... Oh, that's very loud, sorry. It was just a question about sort of service development, I guess. So I'm coming at this from, I work in psychiatry, I'm a core trainee, but we're talking about trying to have like this MDT approach for EDS specifically. I guess my question is, do you think it's likely that it will end up something like that, or do you think it will be more of trying to develop a more systemic, and by systemic I mean health systems, sort of multi-system service, as opposed to just a specific diagnosis pathway, if that makes sense? So, because I'm aware that obviously we're all here talking about EDS, and that's what we're trying to raise awareness for, but there are going to be other conditions that are similar or adjacent that have exactly the same problems that we all have. So I guess it's about that side of service, provision, development, however you want to phrase it. Does that make sense? It's a bit wordy.
Mark, I'll leave that one with you.
I think the problem in a lot of healthcare is we create pathways based on a diagnosis. You have symptom X or you have disease X, you go through pathway X. vast majority of patients turn up at hospital and they don't have the diagnosis. So we have to find a way to put them through a diagnostic process. And what are complex systemic diseases even, need that approach. So, but so I think the way to do that is to get the multidisciplinary team together that can then diagnose which part of it is and then support the treatment. And this is always the problem. It's the same when we look at medical guidelines. Guidelines are always based on a diagnosis. You know, I work in emergency medicine. Most of my patients don't come in and go, I've got X. They come in with chest pain. Well, have you got a pneumothorax? Are you having an MI? You know, have you pulled a muscle? Have you, whatever, a pneumothorax? All these things, you have to then work it out. And I then spend my life saying, well, you haven't got this, or this that are going to kill you tomorrow, so you can go home. So we need to have that. You're coming in with a series of symptoms. We need to get the right people together to try and then come up with a diagnosis so we can then support you. And it may well be we need psychological support because, as Maggie makes the key point, if you've been ignored for 20 years and told that you're basically bonkers, and actually you've got a disease that causes a whole bunch of different symptoms and problems, you're going to become mentally affected because that must be a terrible strain. It must be awful being dismissed constantly when, your lived experience of, I have this, these are my symptoms, and you're being dismissed. That must have a real impact. So we're going to need the full team. We're going to need psychologists, psychiatrists, as well as the rheumatologists, the gastroenterologists, the vascular surgeons, the physios, the OTs, all of those teams. We need to be able to access it. So this isn't going to be a simple solution. Getting that team together at the same time so that they can work together is not simple. And that's why these tertiary services that are set up with it built in tend to not be cheap to run, and they're complex to run, and why they tend to only be in one or two places. But what we've got to try to do is change the culture of, if you don't know what the diagnosis is, speak to somebody who might. Speak to the expert who might be able to give you guidance. Ask questions, don't dismiss. That's the first step, whilst we do the bigger piece about what we pull together.
Professor Packham, your thoughts?
Yeah, I do think we've probably got an opportunity in that EDS is not the only disease that rheumatology looks after which is multidisciplinary. Lupus, scleroderma, vasculitis, all of those need renal physicians and vascular surgeons. And I have to admit, since rheumatology left UHNM and went into the community, those services have not been as good locally or as multidisciplinary locally as they could be. And I know that we have had some recent discussions about trying to re-engender that. And I think one of the important things is to go, okay, well, if we're setting up that multidisciplinary, running a clinic where everything works in parallel, having EDS as one of the diseases which that clinic is responsible for would be a way ahead, which is doable rather than going, well, let's just have a EDS clinic, because that's going to be tricky to sort out in isolation, I suspect.
All right, guys, we're going to leave it there. As we've said, today is all about the start of the conversation. There is evidently so much more to be done, and hopefully this film and everything that we've been a part of along this journey can really kickstart that into action and make a difference for so many people. So ladies and gentlemen, please put your hands together for my panel. Vikki, Connell, Professor John Packham, Mark Poulson and Jared Griffin, ladies and gentlemen. And that just about brings the morning, yes, as we go into afternoon, good timing, just about brings our morning to a close. So thank you so much for coming out and watching the film and being a part of today. The film is already available on YouTube, so search UHNM Charity, search Prim Management, of course search EDS, The Raw and Honest Truth. Watch it back, share it with those who need to watch it and hear it. And once again, thank you so much for coming out and enjoy the rest of the day. Thank you.